Well, Jeff Schlegelmilch joins us now. He's the director of the National Center for Disaster Preparedness at Columbia University. Always good to speak with you, Jeffrey.
Likewise, good to see you.
So, I want to start by just getting your thoughts about this furore in New York with the vaccine mandate for health workers. I mean, it's becoming quite urgent and quite ugly.
Yeah, and unfortunately, we do see a lot of pushback across the country, not as much so in New York, as you just heard, around 90% or so vaccinated. In other parts of the country, unfortunately, that number's lower in different parts of the healthcare system. But the reality is that the healthcare workers are on the front lines of this pandemic. They're the most vulnerable to it, but they're also treating the most vulnerable. And now that we have fully approved vaccines in plentiful supply, it really just needs to be part of the game plan. It really needs to be, if you're going to be interacting with patients who could die as a result of you transmitting the virus to them, you need to do everything you can to prevent that. And that's what the mandate is all about.
Already, though, there is such a healthcare staffing shortage across the country, really. Can New York afford to lose these workers?
Yeah, that's a really tough question because, as you mentioned, healthcare on a good day in not a pandemic, healthcare workers are often in short supply, especially in areas like New York. This puts more pressure on that and could have consequences on the availability, even if it is a smaller number. That being said, though, I mean, would you be okay if someone who was preparing your meal at a restaurant was told they don't have to wash their hands after using the restroom? There are certain things here that are just necessary to keep people safe, and it has to be a minimum standard, and it has to be part of the job description of providing health care and part of the cost of doing business in the healthcare industry. And if that's not the case, then what is that quality of care that's being provided to keep a few more people in the fold?
What a great way to frame that. But, you know, the state of emergency that we're seeing now in New York, is that enough to fill the gap left by these personnel? And really, how long can these measures even last? I mean, how long will it take for the healthcare sector to fill these ranks?
Yeah, so the short answer is probably not. Being able to bring in members of the National Guard does potentially open up a pool of healthcare workers, but a lot of National Guard staff have full-time jobs when they're not activated, so they may already be working. And similarly, by relaxing licensing to bring folks in from out of state, in the middle of a pandemic, I doubt that there are many healthcare workers around the world, much less in the United States, that have a lot of free time on their hands to come across state lines. So it may help here and there, but I think at the end of the day, we have to continue to work with the resources we have in the most safe way possible and to be ready, because there will likely be impacts and it probably won't be able to be fully resolved by some of these emergency measures.
And Jeffrey, you know, how New York handles this deadline is really being seen as a test, maybe even a possible template for other states. Do you think they'll likely follow suit with a similar mandate?
Well, I know other states have looked at this and some are putting it in place. I believe California is, and we are seeing the rollout in the coming months of a national mandate tied to some of the national payment structures and things like that. So I believe a lot of eyes are looking very closely at New York. In some ways, New York has it a little bit easier because we have higher rates of vaccination and we have lower hospitalizations and death rates relative to other parts of the country where you have much lower vaccination rates. So from a process perspective, I think there are a lot of eyes on New York. I think in some ways, as difficult as it's going to be for New York, it's going to be a lot easier than in other parts of the country.
And of course, as we heard in the report there, the conversation is also not just moving to the healthcare sector, but schools, because teachers were meant to be in the same boat, right, on Monday. Are schools prepared for this?
It's a tricky situation with schools because with schools, particularly schools for younger children, they're not yet able to get the vaccine. And so we really have to rely on things like masks and distancing and things like that, particularly with more and more students taking classes in person than maybe this time last year when there was a lot of remote learning going on. So it's a little bit more of a grayer area. I personally think educators absolutely should be. Anything we can do to keep our kids from being exposed to this virus is absolutely essential, but it is definitely a different circumstance than with healthcare workers, and so is probably subject to more scrutiny as we're seeing.
Jeffrey Schlegelmilch is the director of the National Center for Disaster Preparedness at Columbia University. As always, thank you.